Good morning, welcome to Salina Regional's Morning Medical. For the months of November to March are cold and flu season. With me I have Bethany McDowell, who is the infection preventionist at Salina Regional Health Center, to tell us a little bit about the cold and flu and how to keep from getting it. Bethany, what is the difference between cold and flu?
Well, the cold and flu, they have a lot of similarities actually. You get the body aches, the congestion, coughing. However, the flu, you will have more intense symptoms and you typically will run a high fever.
What about the spread of these diseases? What do you do to stop the spread?
Well, with both the cold and the flu, they are actually spread through respiratory droplets. These droplets can actually spread up to 6 feet away whenever somebody's coughing, talking, laughing, or singing. So in order to stop the spread, you're going to want to make sure, of course, the single most important thing to do is going to be hand hygiene. You're going to be wanting to wash your hands with soap and water for 20 seconds, or you're going to want to be using hand sanitizer and making sure you're actually rubbing the product in until it dries.
From the hospital's perspective, what safeguards do we have in place?
We actually have quite a few, and it kind of depends where you're at in the building, whether you're an employee or you're a patient or a visitor. For the main part for patients, our safeguards are going to be that we've trained all of our staff on when the appropriate time to wash their hands are. If you are coming in with influenza-like illnesses, most likely our staff are going to be wearing a mask, and they're also going to be wearing gloves anytime they're working with you. If you are a visitor, we also have things in place such as hand sanitizer. We have masks in place for that as well. However, we ask that visitors, if they're ill, that they're going to stay away from the hospital until they're feeling better.
Okay. What's the most important thing for people to know during the cold and flu season?
Wash your hands, definitely. Washing your hands with soap and water or hand sanitizer, and then of course making sure that you're staying healthy. It might not just be washing your hands. You have to think about everything you're touching in your everyday environment. Things like door handles, elevator buttons, handrails. These surfaces are loaded with bacteria and viruses that you can easily pick up by touching your nose or your mouth. So wash your hands and keep your high-touch surface areas clean and disinfected.
Okay. I also know the use of fever-reducing medicine make you feel better does not necessarily mean you're better, correct?
Absolutely right. What fever-reducing medications do are they kind of mask your symptoms. They are going to treat those uncomfortable things about the flu and colds. They're going to take away your aches and pains, and they may actually, they're probably going to reduce your fever as well.
Thank you very much for the information. Thank you for watching. For more information, please visit srhc.com, like us on Facebook, and follow us on Twitter.